Hi everyone, this is Dave. I hope you are, or rather have enjoyed the first 2 weeks of the course. Of course, today, February 2nd, we are beginning week number 3. Of course, that means a new chapter, chapter 5. I think it's a very good chapter. I like how it discusses the differences and yet the relationships between stress, mental and physical health. And chapter 5 is also the first chapter where we actually begin talking about some mental health diagnoses. And we begin in chapter 5 about talking about stress-related disorders. And those three that we talk about in chapter 5 are adjustment disorders, which incidentally are one of the most commonly used disorders by clinicians, by therapists, for example, followed by acute stress disorder. That is a stress disorder as well. And then there is post-traumatic stress disorder. So we will talk about all three in chapter 5. I also want you to just quickly keep in mind that one of the main differences between acute stress disorder and post-traumatic stress disorder is duration. When you hear the word acute, think short term. So, an acute illness is one that does not last for a long period. And that is what acute stress disorder is a type of stress disorder that does not last for generally for a long period. When it does, when the symptoms of acute stress disorder continue, the person does not recover or, quote, return to normal. At that point, we may be looking at post-traumatic stress disorder, which is a longer-term illness. So again, hope that got your interest a little bit. So we will talk about all of those things in chapter 5. Hope you enjoy the chapter. So, because we're also leading up to our first exam in week number 4, I've already provided the date that the exam will be available for you in Canvas. Remember, it does cover 3 chapters, chapters 1, 3, and 5. Remember, we skipped chapters 2 and 4. So again, chapter 1 is during week number 4. Exam number 1 is during week number 4, and it will cover 3 chapters, chapters 1, 3, and 5. What I wanted to do for a moment here, though, is highlight a couple of things for you that I think will be important for you to remember. So one, when you go back and look in the welcome course content, I hope you've had a chance to go through these resources. Many of them are resources. For example, NAMI is a great resource for both people living with mental illness or people who have a loved one or a friend who may be living with a mental illness or for whom they might have concern. These are also some local treatment providers. Safe Harbor Wellness, they do provide both counseling and psychiatric or medication management services. I'm not paid by them. I don't work for them, but I'm familiar with them. I think that they're a good resource locally. I also wanted you to know more about some local other mental health and addiction services in the greater Fall River area. So those are listed there for folks who may want to know more about the Department of Mental Health. I also included a link. You should have an understanding, although it's not going to be on an exam, for example, but I think it's beneficial for you if you don't know a lot about the Department of Mental Health to have an understanding of what it is. It is a state agency, for example. It does serve children and adolescents, but it mainly focuses on serving adults, but there are services for youth as well. I worked for the Department of Mental Health earlier in my career. It was a very good decision, and if you are looking to work for a state agency at some point in your future, if you are pursuing social services work, for example, I think it might be something worth considering. I'd be happy to talk with anybody if you are thinking about working for DMH in the future or a nonprofit in the Greater Fall River, New Bedford area that provides mental health and addiction services. I'm familiar with quite a few. The other thing I wanted to point you to as well is, of course, the academic calendar and the syllabus. So if you haven't had a chance to look at those, you really should. But what I'm going to go back up here to is the psychosocial and functional aspects of mental illness. This is important, and I'm going to tell you why. First of all, this is important for you to have as a tool as you're beginning to work on your research project. So remember, the research project is a very specific research project. You have a document, a template that you have to follow very closely to answer the questions, and that's what your paper becomes, is your response to all of the questions that I have in that document. And you need to have a good understanding of the psychosocial and functional aspects of mental illness in order to be able to complete that assignment. But I want you to also hold the principles and the concepts of that document in mind as we're going through the course. For example, I want you to be able to think along the way. Let's say when you get to a chapter that's specific to, say, eating disorders, I want you to have in your mind a sense or an understanding of what would it be like to walk in someone's shoes who has an eating disorder. What are some of the symptoms? How might that impact someone to be living or experiencing the symptoms of, say, anorexia nervosa or binge eating disorder? Also, for you to understand or think critically about the impact that those illnesses might have on someone's ability to work competitively, or complete their training. What impact might that illness have on their ability to maintain personal, intimate, family relationships, in other words, social relationships, and so on. So it's very important, I think, as we go through the semester for you to have those things in mind. Again, what could it be like to walk in someone's shoes who has this particular illness or diagnosis that we're talking about? What might the impact be on someone's career or educational goals, depending on what the illness is and the severity of the symptoms? And then number 3, what impact might the illness have on their ability to maintain and navigate social relationships? So those are 3 important areas that I want you to, again, think more critically about as we move through the chapters. But I also want you to have that understanding when you're completing the research project. The other thing I want to point to is you may not have been able to watch all of these videos. However, it would not be a bad idea if you did, and I'm going to tell you why. I may sometimes refer back to one of these in an exam. It's not a guarantee, but I will do that sometimes. But most importantly, I choose these videos or I choose these items because they do relate to the chapter. You will notice from chapter 1 that I did refer to Robin Williams, for example, and the fact that he died by suicide, but also and how that relates to those elements of abnormal behavior that we talked about in that chapter, but also why he experienced subjective distress. And one of them was really the multitude and the complexity of what he was trying to manage in his life. There was talk, of course, that he had a rare form of Alzheimer's type disease toward the end of his life, but may also have struggled with misuse of substances, with a mood disorder, etc. So I would recommend that you watch that video, for example, because I did refer to him, and I think the video could give you a better understanding of what I was talking about in the Chapter 1 lecture videos. I also want you to have a basic understanding of the DSM-5, because I talked about the Diagnostic and Statistical Manual, the 5th version, in Chapter 1. I will more likely than not refer to it again. I might ask you a question about that on an exam, you never know. But just for your own knowledge, it's really important that you understand what the DSM-5 is. What purpose does it serve? Why is the DSM-5 important to the study of abnormal psychology? Why is it important to the people who are the practitioners, the clinicians? Why is the DSM-5 important to them? What purpose does it serve? So you should know something about that. And then, of course, I have the lecture videos are in here. You should take a look at the study guide for each chapter. I put them in there for a reason. And I'm thinking, in my own mind, at least for the moment, as we go through each chapter together and each week together, and you begin to take more quizzes and you get your first or your second exam out of the way, I think you're going to be able or begin to see that I am more intentional about what I cover. There are parts of some chapters, like chapter 1, I did not talk about correlational research at all. I don't want you to. It would be great if you want to learn about it on your own, but I'm not going to test you on anything related to correlational research in chapter 1, or on the first exam for that matter. However, I do talk about experimental methods from chapter 1, so you should know something about that. And you'll see more detail about that in the study guide. So again, between the lecture videos, the PowerPoint that I provide for each chapter, the study guide, and really listening closely, you should get a sense of the things that I'm emphasizing more versus what I don't. Again, you have to find a way to really navigate and organize the amount of information that I provide. And again, I can't tell you exactly what the questions and topics are going to be on an exam, but I think just by thinking about what you hear in the lecture videos, some of the questions that I ask in the chapter quizzes, and what you see in the study guide, I think you should have at least a sense of what I think is important, because I'm focusing more time on talking about it. So on chapter 2, again, that it's a great chapter talking about what are some of the quote causal factors. What are some possible explanations for these different mental illnesses? What might some of their causes be? And what are the different viewpoints or theoretical perspectives that really form the foundation of understanding of some of these illnesses, and most importantly, how they're treated? For example, you'll see here, cognitive behavioral therapy versus psychoanalysis. Psychoanalysis is a type of treatment, type of therapy that is only associated with the psychodynamic approach, also closely associated with Sigmund Freud, who I did talk about in chapter 3 of the lecture video, but you also, I hope, will read more about him in chapter 3. And then there is cognitive behavioral therapy. I will tell you that cognitive behavioral therapy, and it is a well-researched treatment approach, it is a well-documented, well-studied type of therapy, has been shown to have good outcomes, not perfect, but good outcomes for treating types of depression and anxiety. And it's a type of therapy that I'm actually trained in, and I think that it works. It is not the same as psychoanalysis. Psychoanalysis is a different type of therapy, different type of treatment. It has a different foundation to it, a different theoretical perspective. So, again, I'm not saying that one is necessarily better than the other in the long term. However, cognitive behavioral therapy does appear to be more effective when treating certain types of depression and anxiety, and psychoanalysis, for example, doesn't show that same efficacy. Therefore, it would be important for you to know a little bit about both, because if you know a little bit about both, you have a better understanding of the chapter 3 material. Also, Maslow's hierarchy of needs. That is an example of the humanistic perspective. You should have an understanding of the humanistic perspective, and some people, some names, for example, that are associated with it, like Abraham Maslow, like Carl Rogers, etc. There's also the behavior therapy, behaviorism perspective. From that, you get the perspective that some illnesses, there might be a learned or conditioned component to them. And I did talk about both of those things in the Chapter 3 lecture videos. You should watch them, but most importantly, you should do some reading in the textbook as well. I think it'll give you a better, a fuller view. Again, my lecture videos are, I cannot provide the level of detail that the authors do. I am trying to really, I think, find a way to bring some of the material forward and talk about it in a way that perhaps is maybe a little clearer, helps it to be a little more accessible. But ultimately, I cannot bring all of the concepts and all of the philosophies, if you will, the theoretical perspectives into one lecture video. So I am trying to summarize where I can, to highlight some things that I think are important, but the lecture videos don't take the place of reading the chapter, for example, in the textbook. Okay. I also, let's see, I just want to point to one thing here. Oh, yes. Here it is, defense mechanisms. So defense mechanisms are associated with the psychodynamic perspective. That is Sigmund Freud, for example, and others like him that were associated with the psychodynamic perspective. He kind of coined the phrase defense mechanisms, and there are approximately 11. You should know something about defense mechanisms, and there's a great video there that can help to highlight them. Outside of watching my lecture video, outside of reading it in the textbook, but in the textbook, there's also some very good examples that you can, I think, hear, and I think it's another way to learn by seeing them, these concepts presented in a different format, in this case, a video. As the chapters go on, you're going to see, if you haven't already, that I'm beginning to, again, I'm always trying to shift in material that I think will be helpful for you. For example, I have for chapter 5, week number 3 module, I have a video in there that talks about adjustment disorders. I want you to know what those are, even though I talk about them. Again, I'm trying to bring things forward in each module that is related to the chapter that we're covering. That's why your discussion board for this week, for week number 3, is specific to post-traumatic stress disorder, because I think it's important that you really understand what that is. Okay, so I hope this is helpful. I'm really, you've probably figured out, I'm just trying to put in a little bit of a pitch for more of the content that's in each of the modules. I think everything serves a purpose. There are many different ways to learn, and these different items that I have in each module are good examples of them. So, and I'm going, again, they don't replace the textbook. I think the textbook is a very good one, and I would recommend that you get into it. I will also say that there are maybe some concepts that you may either want to read or learn more about, or even after you've watched the lecture videos, even after you've watched a couple of videos, or maybe looked at the study guide or the slide deck, you might still have some questions, and that's why some other questions might be answered in the textbook. The other thing I just wanted to remind you very, very quickly, in the textbook, every single chapter provides a summary at the end of each chapter. It will list key terms, key concepts, and it's really helpful, I think. So I suggest, if you haven't been yet, when you're in the textbook, when you are going through the chapter, is take some time at the end of the chapter to review the chapter summary. Okay, so hope this was helpful. Again, very glad that we're getting into week number 3. I think you'll begin to feel that it's kind of perhaps closer to what your expectations are of this course, that you would be learning more about actual mental health diagnoses. But I think chapters 1 and 3 in particular, I think, give you more of that foundation that you need, and parts of chapter 5 give you the foundation that you need for us to do more work together as the semester goes on. All right. Thank you again, and I will talk to you all soon.